And that is the whole part of direct cholinergic agonists. We move to indirect acting cholinergic agonists. Indirect acting cholinergic agonists acts indirectly, provide cholinergic action by preventing the degradation of acetylcholine. They are divided into two categories which are reversible and irreversible. Reversible indirect-acting cholinergic agonists have a short duration of action while irreversible indirect-acting cholinergic agonists have a long duration. In order to remember all the reversible indirect-acting cholinergic agonists. Remember this statement: in a new physical appearance of the river with bedrooms, a new pie recipe was introduced. New stands for neostigmine. Physical stands for physostigmine. River stands for ribostigmine. Bedroom stands for edrophonium. And pi stands for pyridostigmine. Neostigmine. Neostigmine is absorbed poorly from the gastrointestinal tract, and does not enter the central nervous system. Neo means no central nervous system penetration. Its effect on skeletal muscle is greater than physostigmine, and it can stimulate contractility before it paralyzes. Neostigmine has an intermediate duration of action, usually 30 minutes to 2 hours. It is used to stimulate the bladder and gastrointestinal tract and as an antidote for competitive neuromuscular blocking agents. Neostigmine is also used to manage symptoms of myasthenia gravis. Because neostigmine is poorly absorbed from the gastrointestinal tract, the patient needs a higher dose when taking this drug orally. The duration of when a rapid effect is needed, the drug should be given by the intramuscular or intravenous route. Action for an oral dose is longer, however, so the patient doesn't need to take it as frequently. Adverse effects of neostigmine include those of generalized cholinergic stimulation, such as salivation, flushing, decreased blood pressure, nausea, abdominal pain, diarrhea, and bronchospasm. Neostigmine does not cause central nervous system side effects. Physostigmine. Physostigmine is free, meaning freely penetrates central nervous system. Physostigmine has a wide range of effects and stimulates not only the muscarinic and nicotinic sites of the autonomic nervous system, but also the nicotinic receptors of the neuromuscular junction. Muscarinic stimulation can cause contraction of gastrointestinal smooth muscles, miosis, bradycardia, and hypotension. Nicotinic stimulation can cause skeletal muscle twitches, fasciculations, and skeletal muscle paralysis when taken at higher doses. Its duration of action is about 30 minutes to 2 hours, and it is considered an intermediate-acting agent. Physostigmine is used in the treatment of overdoses of drugs with anticholinergic actions, such as atropine. High doses of physostigmine may lead to convulsions. Bradycardia and a fall in cardiac output may also occur. Inhibition of acetylcholinesterase at the neuromuscular junction causes the accumulation of acetylcholine and, ultimately through continuous depolarization, results in paralysis of skeletal muscle. However, these effects are rarely seen with therapeutic doses. Ribostigmine. Patients with Alzheimer's disease have a deficiency of cholinergic neurons and therefore lower levels of acetylcholine in the central nervous system. This observation led to the development of anticholinesterases as possible remedies for the loss of cognitive function. Ribostigmine has been approved for the treatment of dementia in Alzheimer's as well as Parkinson's disease. Although cigarette use increases the excretion of ribostigmine from the body. Edrophonium. Edrophonium has a short duration of action of 10 to 20 minutes. It is used in the diagnosis of myasthenia gravis, an autoimmune disease caused by antibodies produced by immune system to the nicotinic receptor at the neuromuscular junction. This causes the degradation of the nicotinic receptors, making fewer receptors available for interaction with acetylcholine. Pyridostigmine. Pyridostigmine is used in the chronic management of myasthenia gravis. Its duration of action is intermediate, that is 3 to 6 hours, but longer than that of neostigmine. Adverse effects are similar to those of neostigmine. We also have irreversible indirect acting cholinergic agonist. They have long-lasting effects and are extremely toxic and were developed by the military as nerve agents. One of these drugs is ecothiopate with a duration of action from 2 to 7 days. Ecothiopate produces intense meiosis. A topical ophthalmic solution of the drug is available for the treatment of open-angle glaucoma. However, ecothiopate is rarely used due to its side effect profile, which includes the risk of cataracts. The interactions of indirect cholinergic agonist can occur with the mix of direct cholinergic agonist. Direct cholinergic agonists such as bethanechol, carbachol, and pilocarpine increase the risk of toxic effects when taken with indirect acting cholinergic agonist. And lastly, to remember indirect cholinergic agonist agents' toxicity. Remember the word dumbbells. D for diarrhea. U for urination. M for meiosis. B for bradycardia. Again B for bronchoconstriction. E for emesis. L for lacrimation. S for salivation. And lastly again S for sweating.